Afternoon. I wanted to hit on one other aspect that I didn't hit on in the last video about stimulants in general, but as it pertains to Adderall, Vyvanse, and also Provigil, which is another name for modafinil. Same thing. Provigil's easier to say, but there's two things. First thing, weight loss is one reason why a lot of people unfortunately try to abuse these stimulants. And a lot of times, this is what causes a lot of those bad reactions to stimulants. The only one that in particular really is used for weight loss in particular, it's not an amphetamine, but it is technically a stimulant. It's phentermine, which in its own way has a lot of side effects, but I'm not going to get off on that. But when it comes to amphetamines and modafinil in general, people abuse them for weight loss. And what happens is they start taking them, or even more particular, they're taking other medications with it that are prescribed, and then they'll take that, or they won't report to their doctor that they're taking a specific medication because a lot of times, especially with amphetamines, you get that prescribed through your psychiatrist. You can be referred by a medical doctor, but then you go to a psychiatrist a lot of times. Not all the time. I know plenty of people who get it through their medical provider, but there can sometimes be some confusion in regards to what meds they're taking. Stuff can easily slip between the cracks because they don't use the same, for example, healthcare system. So stuff sometimes can go unreported. And then other times people just want to abuse it in general. But with that, people who try to abuse it or lose weight, what can happen is they can lose weight sometimes pretty quickly, and they'll take with it even, for example, something like what's the thing today, Ozempic or whatever, and they'll see successful results. They'll be taking that, like Ozempic and like amphetamine together. And unfortunately, what happens is they lose weight quickly, but there's a lot of side effects that come with it. And sometimes what comes with a lot of these side effects are not only side effects, that's the problem. A lot of times, what comes with it are a lot of mental mood swings. And one other thing that comes with those mood swings a lot of times is rage, anger, and then higher blood pressure. And with that higher blood pressure, a lot of times, what will happen is they'll have a week of where it can be an appetite suppressant to where they're not eating. Then they'll like rebound eat, and they'll put on a lot of weight quickly. And as it stands already, stimulants constrict your vessels to where when you start eating and whatnot and exercising with it, which you shouldn't really be exercising on that type of stimulant, and I'll get into the caffeine aspect in a minute, over time it can cause overload on your heart. So it can cause a lot of cardiovascular issues, as well as, if you're using it for weight loss, it has a whole nother array of side effects that can come with it. There are some instances where it is prescribed for, surprisingly, and I thought this was kind of interesting. I've seen people prescribed Adderall who have ADD but also have eating disorders. And you would think, well, if it's weight loss and eating disorders, how would that go hand in hand? Sometimes if it's helping somebody if it's helping somebody just in general with whatever the eating disorder is, for example, even vomiting or whatnot, sometimes the better alternative is medication that helps. But that's beside the point of this. Really, they're not prescribed for weight loss. And if you are taking it for weight loss and it's prescribed, watch for side effects. Watch for things such as double vision, the headaches being increased, and check your blood pressures, please. Checking your blood pressures during this time is huge because they should be checking your blood pressure at least every 3 months when you're taking it as it is. And if they're not, you need to be taking it. Because if you're not taking it, a lot of times high blood pressure can creep up on you to where when you do have a big, massive problem, it can be serious. And if it's caught in the hospital or if it gets to that point, it can lead to heart attack or stroke. So if you notice your blood pressure is higher, you're having symptoms of high blood pressure, headaches, even confusion. Confusion can go with high blood pressure or low blood pressure. Anxiety, you feel like your heart rate's really high. Things like this, you don't want those to go unaccounted for, and you want to make sure you're eating. So if you're taking it for weight loss, not something I would potentially recommend, and also it can also lead to dehydration. So you need to make sure you're drinking water. Remember, water is good, but you need to make sure you're getting those electrolytes in, because if you're just drinking water and if it already dehydrates you, you need to still drink 8 to 10 glasses of water. But if that's all you're taking in and you're not eating with it, remember, you take in water and you're not getting anything else, water eventually flushes out all those electrolytes. What it tries to do is, since you're not getting them, it tries to retain them. But then what ends up happening is your urine's very diluted, and it shouldn't be concentrated, but it's like you're just peeing water. Your electrolytes, they're not being utilized. It's trying not to release them because you're low on them. So make sure you're getting make sure you're getting your electrolytes in as well. And real quick, important, I didn't hit on this enough in the last video. Make sure if you do take one of these medications, including modafinil, sorry, get the wording mixed up, or Provigil, you can say it either way, Provigil, I'm blanking now, and amphetamines or non-amphetamines. Anytime you're taking in a CNS stimulant, if you're drinking or using caffeine with them, be very cautious at first. I know I touched on that last time, but really important too, because if you think for example, you start a stimulant or you're changing stimulants, you think you know how you're going to react. But if you're drinking coffee with it, just make sure if you are having side effects at first, try to rule out other things, because it might not be the medication. It could just be your caffeine intake. Caffeine intake can really mess with how you're feeling, how you're projecting, how you're mentally feeling, physically feeling, and it can make you feel very uncomfortable. So before you blame the medication, if you do start, if there's a shortage of your medication, they put you on modafinil or whatever medication they put you on in general. Being a stimulant, make sure that you're not drinking a lot of caffeine, or rule out the caffeine. Because I've seen plenty of times where patients will say, oh, the medication isn't working. The stimulant that I'm taking for ADD or or narcolepsy isn't working. First question I ask with it, I'm like, the effects of it, or even switching brands. And I'm like, well, what else are you taking in? You rule out the medications and whatnot. But then it ends up being pretty simple. You ask about their hydration status, and what comes shortly after it is, besides medications, any other fluids you take in around the same time. And the patient a lot of times will say, just like my normal caffeine. And I'll be like, your normal caffeine? They're like, well, and I'm like, well, what's your normal caffeine? How much are you taking in? Patient will be like, your warm-up cup, your pre-cup, then your second cup, then potentially your third, and then you pop your medication, or you've taken your medication within 15, 20 minutes of that second or third cup. What do you think it could potentially be? A lot of times it can be lowered from there, and then they'll be like, I only drank a half cup and took my medication with it, and I'm not having the same side effects of feeling anxious, racing thoughts, perspiration, sweating, high heart rate, headaches, things like this. So just be very conscientious in regards to what medications you're taking with a stimulant, or even if you're taking in caffeine, too little caffeine, not enough electrolytes, your diet. That's why I wanted to make this video. So really just make sure that, once again, if you're drinking caffeine or taking in other stimulants with the medication, or even your medication interactions, make sure to rule out, if you are having effects from changing stimulants, make sure you rule out things such as caffeine that could be amplifying that effect. And then also, if you're taking it for things such as, weight loss or whatever, which a lot of times it's not prescribed for that, remember. But Modafinil in particular, there are a few studies showing that they've prescribed it for weight loss, but there aren't really effects of it. Haven't seen anything that's been really standing out with it. But for amphetamines, though, like Adderall, extended release Adderall, in particular instant release Adderall, I have seen studies of people taking it for that. But just be very cautious if you are, to make sure you're getting your diet, because it's an appetite suppressant in particular. So just be cautious, make sure you're eating, and from there, that's really all I wanted to hit on. All right, I'll catch y'all later. I'll have another video out probably in the next, 3 days or show. 3 days or show. 3 days or show. 3 days or so. Sorry, I'm getting my words all twisted and whatnot. But yeah, I'll have out more videos, and from there, I'll also do my running shorts every once in a while too. But I'll catch you the next time.